I'm now joined on the line by Dr. Rajiv Fernando, an infectious disease specialist at Southampton Hospital in New York. He was actually in Wuhan in mid-January, and right now he's working at the front lines of fighting COVID-19 in New York. We'd like to thank him for joining us on the line. Good morning.
Good morning. Thank you so much for having me. It's an honor to be on your radio station talking to the people of South Korea. Thank you again.
It's a pleasure to have you. Let's start with your trip to Wuhan in January. I saw your video that you posted. I believe you were there for about a day or so, and it was before the city went into lockdown, and only 3 cases had been reported outside of China. So just to take us back, and for those people who had not seen that video, could you describe for us what you saw there and how the general atmosphere was?
Yeah, absolutely. So we have infectious disease doctors all over the world. We have something called ProMed, which is something that's mailed out to infectious disease doctors all over the world every day, which keeps us really posted on the updates on, what are the infections going around in different parts of the world. And it really leaves it up to us as infectious disease doctors to say, is this going to die down? Is this going to be endemic? Is this going to be an epidemic? Or is this going to be pandemic? So quickly, I saw these cases, these reports happened in, end of December, and I quickly correlated and said, oh, my goodness, this is going to present like SARS. And, I quickly wanted to go down and investigate the cases. I'd made some contacts with people in Wuhan that I was going to be able to talk to on the ground. But, that was difficult. But, I knew there was something going on. And to be quite frank with you, I didn't want to spend too much time in China. I wanted to get down, look at the situation, talk to some specialists, and just get out of there. But that, unfortunately, didn't happen. And I know parts of Asia, they're very sensitive since they've gone through SARS and different outbreaks like this. People, a good sign to know whether the community is aware of what's going on, if there is some sort of a respiratory virus like this. One of the things I use to see is the community wearing masks? And I just didn't see that many masks at that time. So it was a clear index to me to say also the local people really weren't taking this seriously. Because I feel no disrespect to the Chinese government at this point. But I feel the government was, obviously hiding cases. And, when I was there, they hadn't reported a case for a whole week, and that's very troubling information. So, that's what I went down there for, to investigate.
In your belief, then, you don't think that the local people there had any ideas that the city would be placed under lockdown in just a couple of days?
Unbelievable. I just left about 36 hours or 48 hours before the lockdown happened. They had no clue. They did not know what was happening.
Right. In that video that you posted in Wuhan in January, you did mention that even then you believe that China was underreporting the number of cases, especially, as you said, the 1 week of no new cases. Based on your experience there with the lack of transparency, we are still seeing lots of reports coming out of China that even out of China, local reports themselves that the number of deaths, the number of cases may still be grossly underreported. What are your opinions on that? And I'm actually curious, what are the maybe consequences of that lack of transparency and underreporting?
Yeah, I think that's a big concern. And pardon my French, but I'd be a fool to say if we were just to take China's whatever they're saying on face value right now, it would be rather foolish. So definitely I'm in agreement with you. I think there's a lot. China is a very opaque country from my thoughts or my experience. There's no transparency to the world. I've been there multiple times, and there's stuff going on, and but there's just no transparency. Very difficult to get information over there. So I still think there are cases. One of the ways I used to compare to see how it was is I was looking at traffic in Beijing. When I was in Beijing, of course, just bumper-to-bumper traffic. And now when I look at the roads in Beijing, people are starting to get back. The freeways are, slightly getting full again. And, people are starting to get back to normal life. But I wonder whether the government is hiding from its people once again, about the number of cases and the number of deaths. It's very concerning, and it's upsetting for the rest of the world, quite frankly, because we're depending on a lot of data that China has given us to, move forward. China was the first country in the world. And by the time it had gone to other countries, we have the only data that we have is really to look up to China. And like if they're falsifying this information or data, it's very troubling for the world.
Right. You are currently working at the frontline now to fight COVID-19, and I understand that you are in the hardest hit area of the U.S. That's New York, of course. Can you tell me first how the medical staff or the healthcare workers are handling the situation there? Are you completely overwhelmed? What is the situation like?
Yeah, I'm going to describe the situation in the city because I'll also be posted there. But yeah, it's from the beginning when when you're entering the hospitals, you see 6, 7, 8 ambulances trying to get into the hospitals with sick patients, but they just can't even get in. It's so overwhelmed actually. And then getting into these hospitals, of course, it's just unfortunately. A little bit chaotic. I mean, it's the threat of a deficiency of ventilators is real, and there are tough, complex decisions doctors have to make. So for us on the front lines, a lot of times we realize there's probably going to be a shortage of ventilators. I know they're doing a lot to manufacture, but is that going to be in time? So that's the question. But challenging situations like it's difficult. It's very difficult as a physician, but these are coming, and we have to make decisions: who gets to live, or who do we take off support to give another person a chance. And usually we use if it's a less than 1 year expectancy, that's when you say, well, we probably have to pull the ventilator away. Of course, it requires a discussion with the patient's family. That's one. And I always like to have the ethics committee on board so it should be 2 doctors, at least an ethics committee and discussion with the family. So it's very hard. It's very hard for a doctor to just say, this is where we are. The prognosis is poor. But I think people are understanding that right now because there are other thoughts about using 1 ventilator for 2 people.
Right.
These are all thoughts that are coming out while this happens. But it's very emotional for us. I'm a New Yorker, and I will fight for New Yorkers till the very end. I mean, even if it comes to risking myself. I've worked with Doctors Without Borders before, and we go into really troubled situations and in Darfur, and they're difficult circumstances.
Right,
but,
that moral dilemma.
Very committed.
That moral dilemma must just add to the hardships. I did want to ask you, Dr. Fernando, about these reports coming out of New York and the U.S. Because you have the huge number of cases there. You're also seeing very large amounts of data and statistics. According to one doctor at Mount Sinai, he was saying that a fifth of the inpatients, because of the virus, are actually under the age of 50. Are you also seeing this infection affect a lot of younger people, not just the elderly?
Yeah, absolutely. This is something we didn't expect. And, it's interesting because initially the younger people over here were saying, it's not going to touch us. But let me put a statistic in for you. So about 54% of people who are admitted to the hospitals are between the age of 20 and 52 years old.
50, that's more than half.
Young people.
That's more than half.
That's correct.
Wow.
That's accurate. Yeah, the number. So younger people who come to the hospital, they come in really sick, but the chance of them getting better is higher, of course. You're young, your immune system functions. But I always tell people, don't forget the young people. It's very important that they realize as well. One of the demographics that we're seeing is a lot of Hispanic males. It's too early to actually call this, but one of the trends that I see is Hispanic people getting particularly infected. And, I think some of the situations over there for your day-to-day American, you wake up in the morning and you can't miss any COVID-19 news. It's all over the place. And what happens over here for people with language barriers, you don't have that in South Korea, but in the U.S., there are a lot of languages. It's a multicultural part here. And so people, with language barriers, they probably are not getting the information that they need. Immigrant population, of course, stay with a higher density. Many people stay in one house together. So these are all factors, I think, that are involved.
Right. How is the city handling this lockdown situation? And both Governor Cuomo and President Trump has warned that the lockdown will continue for more weeks now. Do you think New Yorkers will be able to handle that for the coming weeks?
It's very low morale. Definitely, people are inside, but I'm so happy. I think over the last week, people are starting to understand, how this lockdown really is real, and people are dying, and now the numbers are escalating, and people are they're really understanding, and I think. For the last few days, I think America is really cooperating. Like I always tell people when I do interviews, I tell them that it takes three hands to clap in this situation. One is the government, two is the healthcare workers, and three, the people. I talk to them all the time. I'm like, you guys got to help us because if you guys are missing the social distancing link, we're going to fail. So I think people are taking that very seriously, finally.
That's good to hear. Last question, Dr. Fernando. You did mention also the wearing of masks and how you saw that as a gauge of the seriousness of the question of the issue in China. Are you recommending to your patients that they should all wear masks and people around you as well? What's your opinion on wearing masks?
Yeah, here's the problem. I mean, the thing is, as an infectious disease physician, as a public figure, people look up to me for recommendations all the time. It's hard to go against governing bodies, of course, like WHO or CDC.
But they're reviewing those revisions now, right? They're reviewing that advice about masks.
Yeah. That's a big turning point right now. If they were to go back retrospectively and say, well, you should have been wearing masks, it's going to be a big problem over here. So, it's very concerning. I've always been supportive of masks, definitely, and I think the WHO, the WHO said it's within 3 feet, and they say here 6 feet. But I don't see the downside. And quite frankly, I'm a big admirer of what South Korea did. I always try to teach my students and residents and how for $1.23 you can get a mask over there, and how the pharmacists did great jobs. Big. I always, when I teach my students, I always try to tell them, look at the model that South Korea did. Look at the model that. Yeah, no, true story. It's fantastic, and I really applaud your response.
Thank you very much, Dr. Fernando. Unfortunately, we've run out of time, but I want to thank you for taking the time to speak with us and also talking about your experience in Wuhan and New York. I wish you the best of luck.
Thank you so much. It's wonderful to be in your show. Thank you.
Thank you. That was Dr. Raji Fernando, an infectious disease specialist from New York.